Thanks for joining us tonight. I'm John Lordson. We're now less than 2 hours away from MNsure's deadline to enroll for January 1st benefits. The deadline comes amid new fear over health care coverage. Yesterday, a federal judge in Texas struck down the Affordable Care Act. The ruling was made on grounds that requiring people to buy health insurance is unconstitutional. But how does that impact your insurance? Kate Raddatz explains what the ruling could mean here in Minnesota.
In a lawsuit backed by 19 Republican attorney generals and 1 Republican governor, a lawsuit was filed earlier this year against the Affordable Care Act. The issue was whether the law's mandate still required people to buy insurance after Congress reduced the penalty to $0 as part of a massive tax overhaul President Donald Trump signed 1 year ago.
It is a big moment, and I think it's going to set off a lot of drama in the coming months.
University of Minnesota professor Larry Jacobs says there is no immediate impact, but the longer term is more unknown.
What comes next? And there we're going to have a series of court cases playing out in the coming months. It's hard to predict, but I don't think it's going to happen overnight or early in the new year.
Minnesota Governor Mark Dayton said in a statement Saturday, in part, "I wanted to remind Minnesotans that the Affordable Care Act is still the law of the land and that MNsure is open for business." That means Saturday still marks the last day to sign up for January 1st coverage through MNsure.
The open enrollment period we're in is not going to change at all. Agents are going to be available on the phones until midnight tonight to help consumers get enrolled in the coverage that's right for them and their families.
On Twitter, the president tweeted his satisfaction with the ruling and asked Congress to pass new health care legislation. Kate Raddatz, WCCO 4 News.
The Minnesota Attorney General's office said they do plan to appeal the law very soon. If the judge's decision ultimately stands, around 17 million Americans would lose their health insurance.